Once the school district had announced that we had a clinic that was really opening to best suit our needs and help us kind of in our families, this was a step in their direction to say, we see you and we do want you healthy in all the capacities that it takes for you to come in and do the best job you can for us. That felt like they care for me as their employee and wanting something for us that not many places have.
In fact, my employees that I convinced, you have to go to this place. I'm telling you, you're going to really, really like it. They came here after the first appointment, said, I'm going to contact my doctor's office and cancel my appointment there because I really liked going there. So that does show that this is fantastic for employees and employers.
I think there's many parts that play to somebody being an unhappy employee within the district. And if we can offer something that provides that, which I think the clinic and the Health and Wellness Center provides to an employee, I think that's a great thing. Because right now it's really difficult. You want to make your retention of employees is so important that the money that you spend on somebody as an employee, anything that we can do to provide them that opportunity to have something that keeps them, that's really, really important.
I do think it definitely has helped me appreciate my employer. I've never had anything like this in any of my previous jobs. So it's pretty crazy to think that like this kind of thing exists and that there are employers who care about their employees enough to allow this kind of thing to happen in a joint partnership.
I definitely appreciate that we have this opportunity to be able to use a resource that is this good from a family perspective.
I'm very thankful and grateful to have been a part of this and receive the medical care that I needed.
I'm definitely thankful that I have a place that we can call home and kind of explore all of our options together.
It's heartwarming.
I've had people who, when they're retiring from the district, and myself soon to be one of them, is how can I continue that relationship even after I have left the district, which we do have that arrangement to be able to offer to them. But I also think that speaks to the relationship that they've built with the clinic while they've been working here in Perrysburg schools, that they still want to continue that relationship, which I think that also speaks to, okay, that had to be a piece of why they stayed here in Perrysburg for as long as they did, as well.
I keep saying that's an asset because it is. I mean, it's one thing in the back of your mind. You're like, this is a huge part of my employment. And if I don't work for this particular company anymore, you do lose that. And you think about that.
Because you're not getting the same benefits outside of WeCare at just your normal, large medical establishment. I will not leave here. In fact, I told my husband if I ever quit my job and decided to retire at some point in my life, that I would pay the monthly fee to continue to be able to utilize this establishment. That is how much I like coming here.
If the clinic were to ever leave or close, or we were ever to remove that as a benefit to our employees, it would be a big, I would have a revolt probably on my hands from many of our staff members. I would have a big problem because I would be getting a lot of emails and phone calls not from people that would be very upset and not happy.